An older adult is likely to experience a fall for many reasons. If you think of a fall as an interaction between the physical environment and certain characteristics of an individual, it's a great way to frame fall risk. Fall risk can come from the environment, the physical environment you live in, your home, for example, both the inside and the outside of the home, as well as fall risk can emanate from the characteristics of the individual themselves. And what I mean by that are things like your physical health and well-being, your overall strength and mobility, your medications, which is a significant factor. Falls can be very detrimental to an older adult, especially in terms of their quality of life and overall function. Being ill, weak, or tired contributes to fall risk. We know that when an older adult experiences physical illness, they are perhaps more likely to become dehydrated, their muscles become deconditioned, and in general, if one is not as active as they have been, you certainly will not have as much muscle reserve to promote a steady, safe ability to rise in and out of a chair, change positions, or even walk with the same kind of gait you once did. All of these things contribute to your being off balance and not having adequate reserve to respond to changes in surface level, for example. So when you're ill, weak, or tired, we know that you are more likely to experience a fall. What can you do to help with that? Certainly, staying hydrated when you're ill is very important. Having assistance when you're ill, if you can't manage your own cares, manage your own dietary needs, for example, eating adequate food and fluid. In particular, protein reserves are very important for muscle strength. We know that over time, when someone is ill, they may not eat as many high protein containing foods, and just your general reserve will be compromised if you don't have adequate food and fluid intake. We know that folks try their very best, but sometimes you do need a little assistance with that. So there are times when an outside agency may be helpful in that regard. For example, at BrightStar, we have specially trained CNAs that can come in and understand what your underlying conditions are all about. They can work with you to see that you get adequate food and fluid. They can help you do simple exercise regimens that will keep your strength adequate. All of these specially trained CNAs or home health aides are overseen by a registered nurse. And that's important because this specially trained set of nursing eyes can help look for potential triggers, if you will, that make you at additional risk of a fall. They, in many ways, serve as that detective with their team of frontline detectives, those specially trained caregivers, to help determine where those risks might be and to reduce those risks. It's a wonderful combination to have the RN oversight and the specially trained CNAs who know what they're looking for and know how to help you reduce your fall risk when you are ill, weak, or just not as strong as you typically are.